So many patients are so surprised to learn that the source of their neck pain and their headache is coming from long-term compensation from an old shoulder injury. Maybe it was 2 years ago, maybe it was 10 years ago, or maybe their job just requires them to move a certain way that is shutting down their rotator cuff and putting too much strain on their spine and their neck. Having a functioning rotator cuff is one of the things that we look for in our office on a regular basis, and in the past may be overlooked. Because the rotator cuff does so much for us, it can easily become fatigued and overworked, especially if the movement patterns that we do in our day-to-day life put disproportionate strain on one part of the rotator cuff but not the other. Think about that burning feeling in your shoulder when you've used it for too long, or that pinching sensation when you reach overhead that makes you shake your arm out. Your body will start to try to avoid these movements. It remembers that burning sensation. It remembers that pinch. It remembers that muscle spasm or that strain you feel when you reach for something far above your head or behind you. Maybe you're typing at a computer or using your hands and your shoulders become tired, but you still need to get the job done. In all of these cases, one of the most common things that happens is your body compensates with the muscles of your spine. Think about reaching up and using your shoulder. When that gets tired and you need to reach, your body is still going to make that reach happen. Now, it might start to recruit muscles of your spine and your neck. So rather than just lifting your arm, you're leaning to the side and lifting your whole torso just to get your arm up. Over time, the strain that this puts on your spine can lead to things like neck pain, headaches, even cause imbalances that lead to jaw pain, TMJ, or even rib dysfunction.